Gentiles shall come to your light, and the kings to the brightness of your eyes. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. The Gentiles shall come to your light, and the kings to the brightness of your rising. The Gentiles shall come to your light, and the kings to the brightness of your rising. I see you, you are rising. I see you, you are rising. I see you, you are rising. The Gentiles shall come to your light. I see you, you are rising. I see you, you are rising. I see you, you are rising. The Gentiles shall come to your light. Arise and shine, your light is come. The glory of God is upon you. Arise and shine, your light is come. The Gentiles shall come to you. Arise and shine, your light is come. The glory of God is upon you. Arise and shine, your light is come. The Gentiles shall come to you. I see it, your light is shining. I see it, it is shining. I see it. Yes, amazing evening. Yes, amazing evening. Do we have anyone online? Let's see you in the chat, please. Now, if you are connecting us on Facebook and YouTube, can you send a message? Let's know we are connected. Good evening, family and friends. This is another time, another impactful time on BFM Live. If you are connecting us, let's see you in our chat, please. Let's see you. Let's see the message. Let's see you connecting with us. Thank you. Good evening. Our guest is here. Yes, share the link. Thank you, sir. Yes, good evening, sir. Let people know that we are live now. Our guest is already here. Thank you. Yes, let's see you in the chat. Thank you, Couples Kononia, Mrs. Olawale. Thank you very much. God bless you. Doctor is already here. Thank you for connecting us tonight. I promise you it's going to be another educative, impactful, and edifying time. You are all welcome. Thank you, Sister Sharon. Thank you. Please send the link. The doctor is here. Our guest is here tonight. It's another time with Blessed Family Life. Yes, thank you very much. Thank you for connecting us from. Let's know where you are connecting us from. Sister Faith from Coventry. Thank you, Sister Sharon from Coventry. Daddy Kayode from Birmingham. Yes, let's see you. Thank you very much. Thank you very much. I'll bring our guest very soon. Now you're all welcome once again. Let's go. The recording will be there. I don't want to waste our guest time. Thank you for another wonderful time again. Blessed Family Live. Tonight, we're having Dr. Sharon Peters with us, an amiable and a very wonderful, amazing doctor. What is the topic tonight? God in science. You know, beloved, Genesis 1:28 says, be fruitful and multiply and replenish the earth. God means every of his words. Now, tonight, I have Dr. Sharon Peters. Is a fertility physician of so many years. She's going to introduce herself. She's from FertilCity Clinic, Lekki, Lagos, Nigeria. And I promise you tonight, it is going to be a wonderful night because it's going to be very educative, very impactful, very enlightening. And I tell you, your expectations shall not be cut short. I would like to introduce my guest, Dr. Sharon Peters. I will want her to introduce herself briefly. While I bring her on board, please help me welcome Dr. Sharon Peters. I'm bringing her on now. Thank you, Doctor. You are welcome. You are welcome. You are welcome. You are welcome. Thank you, Doctor. Can you hear me? Can you hear me, Doctor?
Yeah, good evening, ma'am.
Good evening. Good evening. Can we have
Yes,
some?
I
That place look
can hear
rather
you.
dark. Yes, it look like. Is there a way you can brighten that place or face the?
Can you hear?
Or it looks dark?
Hello.
Is there any way? Maybe you face. Maybe there. Is there any lightning there?
Good, good
We would
evening.
like to see your.
Good evening.
is,
How are you? You
is it
hear me?
possible?
Yes.
We can hear you, but it's rather dark, man. Is it possible to have some lightning there?
Um, just a minute. Some more light where I
Okay.
am. Okay. I'll do that now.
Yes, yes. You can just face the light. If
The
the light
light.
is there, just face it so
So,
that it
so
will not.
my face is still better than my audience.
Mm-hmm.
Is it better?
Thank you for please. Okay,
This one.
no, let's. It should have, yes, it's
Is it
getting better.
better?
Yes, it's better. Maybe
Okay.
you just draw the laptop a little bit back,
Okay,
a little
don't.
bit. Yes. Thank you,
Okay.
doctor. Yes,
Yes. So
sir.
never mind. It's not that I'm not in a dark place. I'm the one that is a dark person.
I know. Don't worry. Once there's light,
Do you
just
hear
face the
me
light.
now?
Don't worry, man. Thank you very much. You are welcome. I don't want to waste your time. Like I said, I would like you to introduce yourself briefly. Though, for those people that attended the last Blessed Family event, the yearly one, you must have met Dr. Sharon Peters, and we learned a lot from her. But now we have a whole 1 hour, with her tonight. We are so blessed to have this amazing doctor. So, doctor, the ball is in your court now. We want you to introduce yourself briefly. Then, what do you have for us tonight? God in science. We are all waiting. Thank you very much, doctor.
Yes. Good evening, ma'am. I'm trying to now join. If you can hear me on the laptop, I'm trying to join with my phone. I don't know if that would be better.
Okay, let's see. Let me see. Okay. Let's see if the phone will be
Uh,
better. Let's see it. Let's see. Let me see. Okay.
yeah. In
Oh,
terms of lighting and all, it appears that it's better. So I just left my laptop. I'm now on my phone.
that's
So
okay.
yeah, so that it can be better in terms of lighting. So good evening, everybody.
Yes.
Um,
Good evening, doctor.
my name is Dr. Sharon Peters. So a brief introduction of myself. Well, I would say that I start my medical journey from University of Lagos. I had my MBBS University of Lagos. After that, I wanted to go with the normal stream of what my mates were doing at the time. So I went to my brother in the US, and he enrolled me from some course in reproductive health with Johns Hopkins University. Um, so I did the certificate course. Then my husband at the time was whining, so and then I left and came back to Nigeria for man. So today I'm blessed with two beautiful daughters. I would
Mm.
send their pictures to Mama to post just before the meeting ends. So it was worth it coming back. So after I came back, I worked for like a year or so, and then I went to the UK. My daughter already came then, and like 2 years, I went to the UK. I started my reproductive health journey from like continuing it after the job Hoskins short course. So I did my postgraduate in assisted reproductive technology with the University of Warwick in the UK, somewhere in Coventry, and then came back and joined the Bridge Clinic at the time. The Bridge Clinic at the time was the foremost IVF clinic in Lagos. So I worked there for several years. While I was there, I got certified as a reproductive endocrinologist from the university, from Montpellier University in France, College of Medicine Montpellier in France. And then I did my so I got a contract with World Health Organization at the time. So I did a postgraduate diploma in public health with Roehampton University. And when that contract ended, I joined the art clinic in Ikoyi, and later I got this job for which I am clinical team lead for FertilCity Clinic. And since then, I've been back in the UK to Southwest University for my master's in sexual and reproductive medicine. So that's been my educational journey, more or less. So this will be my 15th year of working reproductive health and reproductive medicine. And I would say that it's been God all the way. It's the most fulfilling journey a doctor can have, where you get to celebrate life
Mm.
rather than deaths that
Mm.
happen with those doctors. So I feel privileged to be able to do what I do, and I seriously enjoy my job. So
Thank you.
today I'm talking about God in science.
That's right.
Time Mama brought me, introduced me, I just spoke about generally um, the different causes that can lead to the weight. But today I want to talk about God in science,
That's
just
right.
the mystery of reproduction. So, and I'm going to use one case study of a couple that my couples always remain anonymous, by the way, and we practice 100% confidentiality. But I just want to discuss this story to talk about how amazing God is when He wants to bless people, and in different ways God uses to bless couples now. So, in the year 2000, just before WHO started focusing on COVID, they actually said that there is no longer the word infertility.
Fertility.
Now just subfertility. Subfertility means that a fertility of a woman or a couple is less than optimal.
Mm.
They are saying that no couple on earth is infertile anymore. And the reason that is because there are so many treatment
Doctor,
options.
sorry, say that again. No couple what? I didn't get that.
No couple in the world is can be called infertile anymore.
Thank you. Thank
They
you.
cannot call infertile. Reason being that there are so many options available to us,
Hmm.
but through which they can have their children. They cannot be said to be infertile. They will just be called subfertile, which means that their reproduction is less than optimal, but there are so many options available to them. They can always have children when they want to have children. And then, interestingly, um, age is no longer
Hmm. A
serious.
barrier.
So, I want to talk about an interesting case. So, many times when we talk about donated eggs to our older couple, women in their 40s that we have done their tests and we have done their screening, and we have seen that their ovarian reserve is poor. They are usually very unhappy initially until we start to like counsel them and say, what if you were in an accident and you needed blood transfusion? The blood you are going to get, do you know where it is coming from? And that blood becomes part and parcel of you for the rest of your life. How about people who have kidney failures? They get donated kidneys all the time, and that's organ. But I mean, in terms of blood, that's on the cellular level, and then same thing with getting an oocyte or getting a sperm or something. Now, because my practice is in Lagos, Nigeria, we hardly talk about sperm donor because, as a matter of cultural thing, the men in this part of the world are not as open minded as everywhere else in the world that I have visited and studied. So, we would first of all do surgical sperm extraction where we cut into the man's testes, all to try to get his own sperm, so that after you have done all that and there's still no result, then they can be in acceptance that they have done all that they could have and should have done, and then they cannot accept any other thing. But until that point, you don't even offer it because you don't want the child to now grow up in an environment that there's anything less than total acceptance and love. So they usually would be unhappy. So I in an interesting course of event, I managed a 24-year-old young woman who came into the clinic last year. She had found us online, which was like a miracle because at that time our online presence was still very low compared to what it is now. That is a bit okay now. So we still have a long way to go. And she said she wanted to do IVF only for us to. She already had a son when she was 19 out of wedlock. So she had met this new man. He wanted to marry her. He wanted her to be pregnant, so it was going to be easy to process her papers to take her to the US. So we did a test, and in very strange events, the woman did not have follicles, so she did not have
Wow.
ability to produce eggs anymore.
Wow.
And so it was baffling for me because she was so young, 24,
Mm,
especially the fact that she's had a child before. So finances wasn't a barrier. The man came from the US. He was ready to do whatever it took. So we went all the way and stimulated her. And true to the results, there was no response from her.
mm, mm.
So it was very disheartening, of course, for her, for the man, for us as a team and everything. And this woman is so beautiful, and her skin tone is so unusual. So it took us several weeks to be able to get somebody that had a skin tone that actually even was close to her at all.
Mm.
Even though she claimed not to have international, she doesn't have foreign roots, her skin tone was really exceptional. So it took us a long while to get somebody that had that kind of skin tone. So guess what? We got the skin tone, we got the eggs, and then she got pregnant. And okay, fingers crossed, normal and everything. And in the course of discussing after the baby arrived, she said, "Oh, she wanted to know a bit more about her daughter's genetic background." And she was so emotional at the time of treatment to even ask too many questions. So we got the profile of the donor and we're going through it together. So guess what? Her donor was 29 years old.
Mm.
So because of the uniqueness of her skin tone, we ended up giving her eggs from a woman that was half a decade older than her.
Mm.
So it dawned on me at that review because she brought this very beautiful girl. Like her daughter is so pretty. She's probably going to be a model because she has the long legs and long fingers of her father. So I know she's going to be very tall, and the flawless, beautiful skin of her mother, which they were very happy with because I mean the husband thought I got it right, but I kind of try to explain to them that, to be honest, this is all God, because everything could have turned out. First of all, the children could have failed because IVF does fail, and then everything could have turned out that the girl could have decided to come alive looking like the father.
Hmm.
So all that effort of trying to go and get somebody that truly, truly did look like the mother would have been in vain anyway, because the guy is. At the end of the day, I'm sorry, a call was coming in. That's why I didn't want to use my phone. I apologize. I just declined that. So
Okay.
at the end of the day, it just we had to. It just like, apart from me as a doctor counseling my patient, it dawned on me that when God has said is your time, everything in science seems to work. So this was a young woman that has no business talking about egg donation, but she needed egg donation.
Hmm.
And just in the humorousness of God, she's going to get her daughter from eggs from a woman that is actually older than herself,
Hmm. Hmm. Hmm.
because
Hmm.
her ovaries were failing at a very, very young age.
Wow.
So that taught me a lesson. When God is involved and God is ready to bless a couple, it doesn't now matter again. And that is the interesting part. So I have been giving counseling all these 15 years to say there are three factors in getting pregnant. The number one is to talk about the embryo quality. And the embryo is formed by the eggs and the sperm. So the quality of the embryo will depend on both the quality of the egg and the quality of the sperm. And the second will be the quality of the endometrial lining, which is the lining of the womb of the woman, and then the general immunological condition of the woman's body. That's number two. Number three, which is actually number one that trumps it all, is the G factor. Now, we really don't discuss that, because when you're talking about God in a clinic, it actually looks as though you're trying to say, this treatment they are going to do, you are not even going to play a role in it. But to be honest, it's
Hmm.
all God
That's right.
from the beginning
Hmm.
to the end. That
That's
the
good.
eggs will do well, that the
Yes.
eggs will mix well with the sperms, that will have good embryos. Everything is in God's hands.
Hmm. That's right.
And
Thank you.
at the end of the day, that there will be implantation, and then that the the fetus will grow to term,
It
is
can.
all in God's hands. So
Hmm.
my popular saying would say, if it's going to be a human being that will come out of this, it cannot be in the hands of another human being.
Wow.
So my talk today, basically, I'm kind of continuing from discussing all the different causes of infertility that we discussed the last time, where we talked about the tubal causes, where a woman could have hydrosalpinges, where there's fluid in the tubes, where the woman could have tubal blockage, where some women will have congenitally malformed tubes. That means from when they were born, the fallopian tube did not form well. All
Hmm.
those cases would lead to tubal cases of infertility. We could have uterine causes of infertility, where the woman has fibroids, polyps, adhesions from previous instrumentation, congenital malformations of the uterus, adenomyosis, which is endometriosis that is growing within the muzzle of the uterus. And then we could have, of course, we could also have ovarian. Okay, so some women have polycystic ovarian syndrome. They have eggs, but they are not ovulating. Some women would be menopausal, whether early or on time, which means whether in their late 30s or in their 40s. And then some women would have premature ovarian failure. In all these cases, there are no eggs for the woman. But in polycystic ovarian syndrome, the woman actually does have eggs, but is not ovulating, so she's not releasing them, and we can treat for her to release the eggs, and she
That's right.
can get pregnant. And then
Um,
we have the male factor. So male factor usually,
doctor,
for a long time
doctor,
in this part of the world, was um,
doctor. Before the male
commonly
factor,
trivialized. because a lot of men were not going to clinic with their wives, and the women would have gone to clinic multiple times before
Doctor,
the man will ever show
Dr.
up. But
Sharon.
now it's a bit better. I think with the Christian faith saying man and woman should work together and everything, so we tend to see a lot more men in the clinics now than previously. So we now know that a lot of men have low sperm count, which is oligospermia. A lot of them have, okay, the sperm count is within the normal limits, but they are not swimming well. So that's
Doctor,
astenospermia, which means that their motility, their capacity to swim is impaired.
Dr. Sharon,
Then some of the sperms have poor
Dr.
morphology.
Sharon.
So morphology is actually a structural formation of the sperm, where the sperm is supposed to have an oval head,
Okay.
an acrosome for attachment to the egg, a middle part that carries the DNA, and one tail that is usually curved. But
Can I
in the
pause you,
formation, in the
doctor?
process of the spermatogenesis, a lot of the
Doctor,
sperms are abnormal. Some of them will have round head, some of
Dr.
them will have
Sharon.
deep points for attachment, some of them
Oh,
the tail is
is
directly
this really
attached to the
working?
head, there's no middle part. All those types are called abnormal forms of the sperm. So when there's very high level of abnormality in the sperm structure, we'll say that the man has teratospermia. And in many cases, the man will have low sperm count, poor motility, and poor morphology, and that is oligoasteroteratospermia.
Thank
And
you.
then in some really unfortunate cases, the men will have azoospermia. Azoospermia means they will have normal ejaculate, but there are no sperm cells in the ejaculate at all. So we'll do that test at least twice. Sometimes we'll do a third sample to be sure that the man is azoospermic. So once we see that the man is azoospermic, then we want to do further testing in terms of the hormonals of the man. That is how we now differentiate from some men who are obstructively azoospermic and some who are non-obstructively azoospermic. So those that are obstructively azoospermic means that they actually do produce sperms, but there is an obstruction either in their vas or anywhere in the ductals or the seminal tubules. There's a blockage somewhere. So even though they are producing sperms well, they are not just bringing it out. And those we can help with surgical sperm extraction to bring out the sperms used to inject their wife or their partner's eggs, and they are still able to have biological children. The people who have the non-obstructive, on the other hand, are people who we also say they have what we call testicular failure. So usually for these men, they will have much smaller testes than is expected for their age and size, and their hormonals will be completely off, which would indicate that spermatogenesis is not actually occurring. This kind of men would still insist on the surgical sperm extraction, but usually the chances of extracting good sperm and getting fertilization from the extracted sperm is quite low, and chances of having their own biological children is very, very low. But those who
Thank
have
you.
obstructive azoospermia, several of them, with surgical sperm collection, they are still able to have biological children, even though they are producing semen that do not have their sperm cell. So all these technologies are available for women who have had multiple fibroid surgeries. There's the option of using surrogate mothers, where they can have younger women who have had children before to carry children to tend to them. We always tell women, please, if you know that you're having repeated fibroids and you are in your 30s, let's try surrogacy while you are trying to deal with this fibroid. The reason is because we have several patients who now get to their 40s who will now also need donated eggs, and the fibroid doesn't go away for most women. They take it out in another 18 to 24 months, the fibroid has grown back. And
In fact,
fibroids, they are just a nuisance, they're a menace. They keep going back in these reproductive years where the
okay.
women need their uterus cleared and free. And then when the woman is menopausal, where she doesn't need it anymore, because she also is not producing a lot of estrogen anymore, the fibroids become redundant. So they are just a menace, because when you don't need them, they are there. When you say, okay, I don't need the uterus anymore, you can as well grow there if you like, then they cannot grow because there's also no estrogen, there's not enough hormones for them to thrive on at that time.
Thank you.
So at
Thank
the
you,
end of the
doctor.
day, so
Doctor.
there's also surrogacy. And then I was in Edinburgh in May, and
Okay.
because I'm also part of the American Society for Reproductive Medicine and the European version. And then with this Brexit of a thing, so UK, they are now having their own association. So we had the first meeting in Edinburgh in May. And now some doctors in Israel and in UK are now doing uterine transplant.
Mm.
So they've been doing it according to them in mice and guinea pigs and all that, but they have now started doing it in humans, where a woman who was exposed to who was to have a cancer treatment. They brought two cases. Um, One was to also have cancer treatment. So they saved her eggs and banked them for her. And then after she did all her radiotherapy, chemotherapy, they saw that her uterus was very flaky and almost not usable. So they did 4 hours surgery
Mm.
to remove uterus from her older sister who already had children and didn't want to
Wow.
continue having children, and use 8 hours, 45 minutes to anastomose vein to vein, artery to artery,
Wow.
and nerve to nerve of this
Wow.
new uterus into the woman. And so with that, she was able to, and they waited to be sure that there was good circulation. And then they brought out her eggs she had stored before she did her cancer treatment. Um, did the fertilization, transferred into her, and she got pregnant, and they did C-section for her to deliver.
Wow.
So this
Wow.
is
Wow.
why WHO can say boldly that no woman is infertile anymore.
No
It's
woman.
just subfertility, because really the options are endless. I would
Mm.
like to say that in my 15 years, I have never seen, whether in the US, in Europe, in the UK, anywhere in the world, where there has been any serious grants dedicated to study or improvement of fertility medicine. The reason is because, first of all, the people who donate to grants actually already feel that there is hyperpopulation in the world, so
Okay.
they couldn't be bothered
All
about
right.
improving
Oh,
reproduction, basically. And
wow.
then secondly, because reproduction is tend to be a need, not necessarily that the couple are unwell,
Mm.
in the sense that they are not sick, they are not dying, they just have a need that they want to take care of. So nobody is considering it important enough for there to be millions of dollars grant, like giving as grant for researches to be done the way
On that.
for other diseases get yearly.
Mm.
Yet, there's been so much advancement from when I started doing reproductive medicine, when we're doing day 2, day 3 transfers, where 2 days after you remove the egg, you have to quickly put it back in the uterus, and you have to put back a lot, because there was no technology to keep culturing and developing the embryos in the laboratory, to now that we can develop them up to day 6, now that we can do laser assisted hatching, now that we can do biopsy of the
Mm.
embryos and be able to roll out diseases like Crohn's
Thank you.
disease,
Thank
monogenetic
you.
testing for people that are ASAS, so that they will only have embryos that do not have SS, that are not
Wow.
sicklers, for people who want family balancing, and all these kind of things, to rule out chromosomal abnormalities for older women like Down syndrome, trisomies, monosomies, all these without grant, without really support, just continues to fulfill the will of God,
Thank you.
that we
Thank you,
should go
doctor.
into the world and we should multiply and we should
Thank you.
dominate this earth. So even though we're not really getting help, but God in his infinite wisdom, God is omniscience, things just keep evolving and getting better. Pregnancy rates globally are improving. Treatment options are endless.
Mm.
Treatment protocols are endless. Everything is coming together and working together, and several thousands, if not millions, of couples yearly globally are having children, for couples who would never have had. So
Thank you.
we give glory to God, and we thank the God that is working in science.
Wow.
Good evening.
Wow. Thank you, doctor. That was so amazing. That was so impactful, eye-opening. Thank you so much, doctor.
Hello.
Thank you so much. Please, for those people connecting us, it's time for our questions. Can you just appreciate the doctor in the chat, please? Yes, thank you, doctor. Can you appreciate the doctor? We've had so much, we've had a lot of tips tonight. Now it's time for our questions. It's time for questions. Let's see your question in the chat. Doctor, I was even trying to pause you that before you go into the male factor, I wanted to tell our audience that they should prepare their questions and put it. But
Hello,
thank God,
ma'am.
are you hearing me? Are you hearing me, doctor? Okay. Can you hear? So, yes. Can you hear? Can you hear me, doctor? I think the audio is not working. Let me just check with the doctor. Oh, okay. The doctor will come online again. Please, let's have your questions. Any question you want to ask the doctor is like this is today is free consultation. So, because even after this live streaming, if you need to consult the doctor, you are going to pay for consultation. So today, I believe it's free. So this is an opportunity for you to ask doctor any question. Thank
Yes.
you. Doctor, can you hear me? Seems as if the audio is not really working because I've been
Yes.
trying to.
Now.
You can hear now. Hey, I've been trying to stop that, doctor, before you go into details of the male factor. But that's good. That's good. Thank you, doctor. Please appreciate the doctor in the chat. Let's have your questions now. It is free consultation. We are blessed to have Dr. Sharon tonight. Now, you did say something about fibroid. I want you to elaborate more. Those people that have the issue of fibroid, what are the chances they have? No, we
Okay,
have.
so
Can you just yes?
yes, there are three types of fibroids, ma. There are
Yes.
some subcells that grow outside of the uterus,
Mm-hmm.
and unless they are very big and they are pulling on the uterus, causing the woman to have pain or causing her to have menorrhagia, that's heavy bleeding, we actually ignore those that are outside of the uterus. Then there's another group that are inside of the muscle of the uterus. So that one it just depends on clinical acumen and who is managing. Sometimes the one inside the muscle can be ignored if they are small and they are just completely within the muscle and they are not affecting the endometrial lining of the womb, which is where the embryo is supposed to implant on. But those that are called submucous, they are the ones inside of the cavity, inside of the womb where the embryos should stay, where the fetus should grow. So number one, those are the ones that are problematic because they have to be removed. Number one, where there is a fibroid, it is difficult for an embryo to implant because
Hmm.
myomas are muscular. So if you put an embryo on a fibroid, it's unlikely to implant. So first
Mm-hmm.
of all, they affect implantation rates. That's one.
Okay.
Secondly, because even when there is an implantation, because they are inside the womb with the fetus, they
Yes.
will act as a space occupying lesion. So they'll compete with the fetus for nutrient, blood supply, and everything. So, in terms of fibroids, fibroid is not like a death sentence or an infertility sentence. It just depends on one, their location, two, their sizes, three, whether or not the woman is symptomatic. Some women will have very small fibroids
Mm-hmm.
inside the muscle of the uterus. They can easily get pregnant, but they feel so much pain
Mm-hmm. Mm.
from degenerative changes in the fibroid. Those women will still require to do myomectomy to go and remove it. Meanwhile, you see a woman that has a fairly big fibroid, but it's outside of her womb. She has had one baby, she has had the second one, she's having the third
Mm-hmm.
with fibroid there.
Wow.
So it
Mm.
just depends. So that's why we always say first things first. Any couple having any challenge at all, first thing to do is to get assessed. See a doctor. Know what
Okay.
kind of fibroid it is. Know the size. Know the location. Then you can take a clinical decision with your physician on how best to manage you.
Okay. Thank you, doctor. There's a question in the chat. What are the options for a man with low sperm count, please?
Okay. So now it depends on how low the sperm count is. So sometimes when it's just a little bit lower than what the optimal should be, WHO is now saying it should be 15 to 20 million and above. So for a man that has 14 million, and the woman is ovulating regularly, they are likely to still be able to get pregnant in the bedroom.
Hmm.
So, but if it's down like maybe between 10 and 12 million, they can still benefit from conventional IVF, where you take out the eggs of the woman, you mix it with the sperm,
Mm-hmm.
and then it can fertilize and you put it back. But men that really have very poor sperm count, as long as they have sperm, the sperm will be used for what we call IMSI. So it's an ICSI bulb for with morphologically selected sperm that is injected directly into the cytoplasm of the egg to fertilize them. So no matter how low the sperm count is, there is a chance of them getting pregnant.
Hmm. Thank you, doctor. That was like somebody said. This is very educative. Yes, please ask your question. This is today's free consultation. After today, you are going to pay. Before doctor can give you all these wonderful tips, you have to pay. Though we have some discount for those that come from Blessed Family Ministry. So please ask your question. Please, ma, let me see this question in the, let's see. Please, ma, some Christians that are spiritual. Who is this? Fanatics do argue that artificial insemination is not biblical. How can we convince them? Do you understand that question, ma?
Yes, I understand.
Mm-hmm.
So many years ago, when IVF was just starting in the late 1980s,
Mm-hmm.
um, the Pope at the time, the Pope of the Catholic Church, came out and said there has to be a definition between there has to be a definition as to when life starts.
Hmm.
So there was the argument that when does life start? Is it at a point where the egg becomes fertilized with the sperm, or is it at the point where there is now implantation of the embryo into the womb of the woman? The doctors at the time were trying to argue that life starts at the point where there's now implantation.
Hmm.
But the Catholic Church at that time insisted that no, it was at the time that the egg has accepted the sperm. So fertilization has occurred, so life has started. Why was that discussion coming? That discussion was coming because in the early days of reproductive medicine, there was nothing like freezing,
Hmm.
like preservation. So they were doing it then for women who had blocked fallopian tubes. They would give them medication, aspirate their follicles, bring out the eggs, inject with their husband's sperm, and once they see that it's fertilized the next day, they will put as many as they feel is risk worthy,
Mm-hmm.
and every other one they will have to discard.
Hmm. Hmm.
At that time, they were not even culturing because the technology was not available. They were just trying to help to fertilize that egg outside of the body because women had unfunctional tubes or dysfunctional tubes.
Hmm.
So that's where the name in vitro fertilization came from. The fertilization was happening outside of the body. Every other thing was happening inside of the woman. They bring out the egg. Once they check the next day and it has fertilized, they put them back.
Hmm.
But for example, at that time, they collect like 12 eggs. It was happening in the UK. The women did not want to have a lot of babies. So they were happy to risk like triplets, quadruplets. So they'll put three, four. All the other ones that were fertilized has to be discarded because there was no technology to do any other thing with it.
Hmm. Hmm.
Hence the talk of they said there was wastage of life.
Hmm. Okay.
Yeah, that was the topic at the time. But since then, technology has evolved. Then they went to slow freezing, then they went to freezing optimization. Now we do vitrification,
What's
where we are
that?
able to stop embryos in time and it can stay like that for 10 years. And you
Wow.
can come, warm it out and use it, and the
Wow.
woman will get pregnant
Okay. Okay.
with,
Now.
with absolutely no risk to the babies.
Hmm. Hmm.
So, with that, things are changing. So there's no longer that wastage that quote and unquote was the problem at the time.
Okay. Okay. I don't know whether somebody asked this question again. What are the legal policies associated with vitro fertilization. I'm sure it means IVF. What are the
Yes.
legal policies associated with IVF?
So IVF is legal globally, all over the world. We are
Wow.
having challenge right now with IVF is in a place where country by country there is the debate on surrogacy.
Hmm.
So every
That's fine.
country has their rules and regulations of
Oh, wow, wow, wow.
what they think the surrogacy should entail, and that is the
Doctor.
and that is the current issue globally all over the world. The IVF is legal. There is no place in
Okay.
the world where IVF is illegal.
Okay. Thank you. Please, there's another one in the chat. Please do help to have Dr. Sharon contact. Of course, mobile contact for further inquiries. Yes, when you look at the recording of this live streaming, you will see the details there. Even the website has been sent to me. I will still upload that. Now, there's another question here. Thank you, ma. Let me read it. Thank you, ma. Please, what could be the cause when one have had a miscarriage and after the miscarriage you saw your period the first month and after then no period has come? I don't know, doctor, are you seeing the screen or can you hear me? Can you hear the question?
I hear you clearly.
Okay.
I hear you
So,
clearly. Now there can be various reasons. It could be that there's some hormonal imbalance going on, which is why maybe there was a miscarriage in the first place. So they need to go check. Just I think it's a simple assessment. First things first, if there has
yes.
been a period and there is no period, let's start from the simple, uncomplicated one. It's possible she's pregnant again. Do a pregnancy test. So if the pregnancy test is negative, then you need to see a doctor to assess why the period is not coming. But if the pregnancy test
Mm,
is positive, then I think this question is already answered. You don't need to do anything
okay.
after that. You need to go start antenatal. So,
No.
firstly, it's just possible that she's taking in again, she's pregnant. Secondly, it could be hormonal. Thirdly, it could be an infection, maybe from the miscarriage, retained products of conception, all that managed well. But she just needs to get access. But first things first, do a pregnancy test and let's celebrate if it's positive.
Thank you very much. I think this next question is almost similar. Thank you, ma. Please, what could be the cause when one have had a miscarriage and you saw your period first month and after the no period? I think it's the same question the other person. Then
Yes, same question.
people are asking for your contact. I'm sure before we finish, we are still going to dictate your phone number and your ID and do Dr. Sharon P. Anyway, we'll give you the details. Now, like I said, today is free consultation. After today, you are going to pay for consultation. Everyone is asking for a doctor's contact now. So this is an opportunity for you to ask your question. We have
Yes.
about 10 minutes more. Ask your question now. We are blessed to have Dr. Sharon in the house. Like he has said, no woman is said to be infertile again. The
Hmm.
infertility is non-existent. That's why we said when you look at the flyer, I said demystifying infertility. There are some myths, there are some stories about infertility in the past, but technology has gone beyond that. Now there's something you even open my eyes to today, which I must confess to you. There are some of us, yes, we have some biases over certain process, surrogacy, donor, and all these things. Up to now, because of our background, cultural background, religious background, or our faith, we are still biased about certain aspects. But you said something that was profound. You spoke about kidney transplant, and
Yes.
that gets me thinking. If somebody had issue with kidney, we don't see anything wrong in transplanting. That was profound, doctor. I've never seen that way, because even up to now, despite bringing you on board, I still have my reservation about certain aspect of it. I must tell you, that's my own. But with that's why we said this teaching, this live stream is very
So,
educative.
how about blood transfusion, mama? Who rejects blood transfusion? It's the
You
same
see,
thing.
you see, you see.
This is
Even this IVF. years before. Some of us, even when we heard about it, no, no, it was no, no, no. But now we could see. You know, one of the miracles that we say happened in Dr. Sharon's clinic, when I heard that a 53 years old woman had triplets, I can't forget that.
Yes.
53 years old. Who would think that 53 will be able to conceive, if not for miracle? So
Yes.
even this IVF that
Not
we
for
talk
God
about,
is science.
so if God is not there, it won't work. There are some
Yes,
people that have done it several times. So
that's
it has
right.
to be God there. So I really understand why you say God in science. It's just a matter of opening our eyes, opening our understanding, educating us. If we have more questions, we have few more minutes with Dr. Sharon. If you have any questions, can you just okay, meanwhile, before they ask the next question, doctor, can you still tell us your contact details, because people are asking for your contact now?
Okay, so my phone number for which they can reach me on WhatsApp is +234 80 231 64353. That is the number. +234
Do we,
80.
sorry, do we have some of our admin to put it in the chat, please, for others? Sister Busayo, if you are still there. Sister Sharon, can you just, doctor, can you call that number again? Though I will still put it in the in
So
our recording. Okay.
+234
Yes.
80
Yes.
231 64353.
Thank you. Thank you, doctor.
Yes.
Your
And
Instagram handle.
yeah, Instagram, we are at Dr. Sharon P on Instagram. On
Thank you.
Facebook, it's just Ask Dr. Sharon.
Ask Dr. Sharon on Facebook. Okay,
Yes.
okay.
And then on Instagram is Ask Dr. Sharon P. And then the clinic's website is www.fertilcity.com.
Thank you. I think I've even shared some your clip from your Instagram on my WhatsApp group. How can, now there's a question here, doctor. We still have about 5 more minutes. How can a
Yes.
woman maintain a regular menstruation flow after a long break of its normal experience?
Okay,
How
so
can
yes,
yes.
so firstly, it depends. So what is the cause of this long break? If the long break happened because she was pregnant and then after she had the baby, she was breastfeeding, it will regulate itself after lactation. After lactation, when she stops lactating, prolactin levels will drop back to normal levels and the period will regulate itself.
Hmm.
Now, if it's now having a long break because the woman is having premature ovarian failure, like for younger women,
Mm-hmm.
usually those women will just put them on supplements and then the
Hmm.
period will come irregularly as he likes because you
Wow.
don't want to go on HRT too early because of the possible side effects. But women who are older and who are having severe menopausal symptoms may decide to go on hormone replacement therapy to have their periods.
Hmm.
Now, routinely, for just like when I was in Edinburgh, in the UK, routinely women go on hormone replacement therapy routinely. But in this part of the world, we are so afraid of medicine and afraid of things. We would rather use herbal things like ginger, beetroot, and all of that to manage the symptoms of the hot flushes, and we'll be on vitamin E and all that to help to manage bone vitamin D and all that to help to manage bone pain rather than to be on any hormone replacement therapy. So I firstly we need to know the cause of this long break in the period for me to be able to tell this house today how we could get the period to be regulated.
Hmm. Thank you, doctor. There is a question I've had in mind to ask you. How long should a
Go ahead.
couple wait? Hello, ma.
Okay. Yes.
Okay, this is from me. How long should a couple wait before seeking fertility treatment? You know, for a young couple that are just married, how long should they wait before they start seeking for treatment?
Okay. So now we say, even though WHO is saying that, to even say that a couple should go and see a doctor, they should have had regular unprotected intercourse for the period of 12 months. That's
Okay,
what they.
1 year.
Okay, so but we in practice, that is in theory, right? Because
Mm,
I mean, World Health Organization is they are like preventive rather than therapeutic, right? In
okay.
theory, we say 12 months of regular sexual intercourse. So a lot of people take that 12 months as literary, but it's not literary. It's regular sexual intercourse. Regular means 3 times a week for 12 months. That and for 12 months. So and a year, which is 12 months, has 52 weeks. So 52 times 3 is about 150 times. So now when you have a young couple in their 20s, but they live apart, maybe
Mm,
they live in different countries because of work, or they are doing these their onshore offshore things, then we say that if they wait for a second year, it's not a problem because they are not really having as regular intercourse as they should be
okay.
because of their location.
Mm,
On the other hand, if a woman is 40 and her husband is 45 and they just got married yesterday, I'll tell them to come to the clinic tomorrow morning.
that's right. That's right. You- okay, I
Tomorrow, so
understand.
just so it's not, so there's no like hard and fast rule. That's what I mean. The woman is getting married for the first time at 40. Her husband
Mm,
is only 45. They got
mm,
married on Saturday. If they are seeing me this evening, I'm telling them to come to clinic for assessment tomorrow
that's true.
because there's no time.
In fact, I was going to ask you, is there any
Even
age
when
limit?
they're in,
Thank you. Thank you.
yes,
I think you've answered my next question. It's as if you are reading my mind. Thank you. So the issue of waiting for 1 year does not apply if you are older. Thank
yes,
you.
you have to
Thank
do it
you.
right away because you might just be losing the chance to use that woman's egg by waiting.
Our time is up. There's another question about women biological clock, but maybe when we have the opportunity to bring Dr. Sharon again. Now,
Okay,
mm,
I'm always here, man. Just give me a notice. I'm
wow, you see that we are blessed. Thank you, doctor. That's an open check for us. Now, you did say you will give us, for those that will refer from the ministry, I want them to hear from you.
okay. So I said everybody coming from Mama, I will give them 5% discount.
That's right.
Once once they're able to say that they are from
From
this,
Blessed Family Ministry. I
yeah,
hope you
blessed.
had that. I hope you had that. Even for your assessment, try to consult the doctor, please. Infertility is non-existent now. Please
Yeah.
consult the doctor. And then doctor, you can consult doctor anywhere all over the world.
Yes, yes,
Please,
yes. I do Zoom
please,
consultations every day.
no
So
barrier.
there's no
Thank you.
barriers. We're
Thank
able to
you.
even direct people go and do this test. They do it in wherever country they are. I assess the test for them, make recommendations, and then it's only when they want to do the treatment they can come to Lagos. So there's no barrier at all. They can just contact me.
You see, so you can even be assessed if by the doctor. So there's no barrier in terms of
No,
where your location is.
yes,
She can assess you, which you
yes.
all need. And this brings me to the issue of assessment. How will you uh, advise a couple who have been waiting? How will you, for those that have been waiting maybe for over 5 years, the issue of assessment? What will you advise? Because in the last Blessed Family Ministry, you said something that was profound. You said there are some people that will come to the clinic. You realize that after 10 years, they've not done any assessment. How important is the issue of assessment for
Okay,
couples?
yes. So that's what I'm saying. Once they've been married
That's
1 year,
that's
then they
right.
should assess. The truth is that assessment is just to either know if there's a challenge or to reassure them.
That's right. Thank you. Thank you. Doctor, we have to say
To be
bye bye.
reassured,
Okay, I thought you've
it's
gone. Okay.
okay. Don't
Okay.
panic. Everything is fine.
Okay. Thank you so much, doctor. Please help me appreciate doctor in
Hello,
the chat, please. Yes.
hello, ma'am.
Yes. Yes. We are still with you. We are with you. So please, for those of you connecting it, what about those who you are still asking questions when we are rounding up? What about those who have been waiting for more than 25 years? Can you answer that, doctor? But as doctor is answering that, please appreciate her in the chat, please. Yes.
Yes.
What
So
about
for
those who have been waiting for more than 25 years?
I'm sure those people would have been assessed, and they must know that there is a challenge. So they should reach me. Let's discuss the challenges and how we can surmount them.
Did you hear that? Thank you,
Yes,
doctor. Thank you for this offer. Now, can you please appreciate Dr. Sharon? Dr. Sharon, we really appreciate you. And like you said, we can always call on you anytime. Oh,
yes,
bless you. For those that are appreciating Doctor, thank you so much. Thank you. We really appreciate you, Doctor. And we
yes,
know it's really you are a blessing to us. Like I said, it's like a ministry, a calling. You know,
yes,
this what you are doing. Apart from a career profession, it's a calling. And
yes.
I thank God for so many people that have been blessed through
With
your
them,
career. I really
yes.
appreciate you, and we thank God. We thank God for making you a blessing to us. Thank you, Dr. Sharon. We
So
are
much.
grateful. Thank
Yes,
you.
thank you.
Thank you,
Yes,
everybody. Thank you. Help me appreciate Dr. Sharon in the
thank,
chat,
thank you,
and
ma.
see you again. Thank
See
you
you
very
again
much.
soon.
Thank
Yes, ma. Bye.
thank you. Thank you. Thank you. Thank you. Thank you. Wow, wow, wow. That was wonderful. That was an eye opener, enlightening. Thank you, family and friends. I believe you have all been blessed. Next month is another time for Blessed Family live streaming, and we are bringing another. Thank you, Doctor. Yes, thank you for appreciating her. Thank you so much for connecting us to that. Now, please share this link. I believe this tonight discussion will bless so many people. So please, we want you to share the link to others. Let them learn. Let them know that infertility is now no is non-existent now. Nobody should be trying to be infertile. Technology has gone beyond that, and we just need to educate ourselves. You heard what the doctor said about analyzing it with kidney transplant. I myself, I have some biases about certain area of IVF before now, but thank God, knowledge is golden, information is key in life. So I believe we have all been blessed. Now, have you subscribed to this our YouTube channel? If you look at the channel, there are so many videos there that will be a blessing to you in the area of family and marriage, in the area of our health, our faith, our marriage. Please connect us through the YouTube and Facebook. And then we have WhatsApp group that we share posts and messages that will benefit us as families. So connect the Blessed Family Ministry. And for this live streaming, we always have live streaming once or twice a month. You have to connect to this YouTube to know all the programs we have for you. Thank you for connecting us tonight. And thank you for sharing this link so that to bless others. It's about blessing others. We are here to bless our generation. And you know what we have discussed tonight? I'm sure all of us that have been online have been blessed one way or the other. Thank you for connecting us, and I hope to see you very soon again. Thank you for appreciating the doctor. Thank you so much. Thank you. God bless you. See you soon. If you have not connected to this YouTube, please connect to it, subscribe to it, and check all the videos. We have several recordings there. We've started this live streaming since last year, and we have done so many. We have discussed on so many topics, so many areas that impact families. So check the YouTube and check those videos there. Thank you so much for connecting us tonight. So see you next month again by the grace of God.
I shall come to your eyes. I see
I remain your host, Taiwo Kayode of the Blessed Family Ministry. See you soon. Thank you very much.
it, it is shining. I see it, it is shining. I see it, the light is shining. The Gentiles shall come to your light. Gentiles shall come to your light. And the kings to the brightness of your eyes. The Gentiles shall come to your light. And the kings to the brightness of your eyes. Lift up your eyes, round about and see. They gather together to come to you. Your son shall come from afar and near, and your daughter shall be cast at your side. Lift up your eyes, round about and see. They gather together to come to you. Your son shall come shall come to your life. I see them,